Hi, sweethearts, it's Amber. Today is Wednesday, and we are talking about how to start tea in the state that we live in. Stefan and I live in Ohio. Ohio is not an informed consent state, so what that means is Stefan did have to see a counselor before he was able to get tea. There are states where if you sign a form that basically says you understand the the things that can happen on that drug, the side effects of the drug, you're able to get the drug without going through the same process. But Ohio is not one of those states. Stefan started seeing a counselor in end of July, 1st of August of 2011, and he actually only saw her for about 4 months before he received a letter from her for tea. His time period is really, really short. So I think there are three kind of major categories of of what makes the time period from first seeing a counselor to getting a letter vary. Some of it is counselor preference. So there are counselors who say that they have to see you for 6 months or they have to see you for a year before they'll give you a letter. Some of it is the doctor who would be prescribing the tea that requires their patients to see someone for longer. And then the third thing is the person who is actually wanting to start tea, depending on their support system, their mental state, any mental health issues that they need to work through, any kind of baggage that they're walking in the door with that could make transition difficult for them. The counselor is going to want to do the best that they can to shore those things up and to come to a good place and some sort of resolution about or address any of the issues that are present before saying, yes, I feel like you were ready to go on tea. After Stefan got his letter, he actually asked his counselor if she knew of doctors in the area. She was able to give him a couple recommendations, and he also consulted with a few other people and chose Dr. Brandt, who is out of the Wright State University Physicians Group. And Dr. Brandt is wonderful and treats lots of trans patients here in the area. Dr. Brandt did a full workup, everything from family medical history, Stefan's medical history, and also did an extensive set of blood work to make sure that everything was okay. Because they want to make sure that every single level, as much as possible, is within the normal range, so that as that person begins tea, that you have one, a baseline to work off of, and two, that you don't start tea on someone who may need to address some medical issues first. So from the time that he first saw Dr. Brandt to when he had his first shot, it was about 2 or maybe 3 weeks total, because he went to do blood work after that first appointment, and then it took them a week or week and a half to run everything that Dr. Brandt wanted to have run, and then for Stefan to get back in and actually get the shot. His first year on tea, he was seeing Dr. Brandt about every 3 months or so. Now it's every 6 months now that he's a year out. And then once he has his histo, he'll be able to look at going about once a year, assuming that there are no other issues going on. So that's a really brief kind of how to start tea in Ohio. But I think Ohio is kind of within the standard around what you would expect, seeing a counselor, getting a letter, having a full blood workup, and then being able to get tea. I hope everyone has a great week. Our topic next week is gender change. That video will probably be a lot longer because it's a bit of a nuanced thing here in Ohio. So, see everybody next week.